Okay, sir. Sure. Thank you, sir. Thank you. Thank you, Hindi team. Thank you, Dr. Neha, and thank you, Dr. Sahani, sir. Now we are moving to the English session. Before beginning the session, we will have a silent prayer. Before that, Dr. V.K. Karunakar, please. Okay, now he is the co-host.
Yes.
Okay, let's start the session with a silent prayer. Thank you, everyone, and welcome. Today is our 1759th day of continuous webinar. We are conducting this webinar without any break and without any leave. Thank you all for being with us. Thank you all the faculties taking time for sharing your knowledge. Thank you so much. Today's our guest is Dr. V.K. Karunakar. He is a medical officer in Government Homeo Dispensary in Nellore, and he worked as a senior consultant in Karina Homeopathy Care, Kadapa, Vinayaga Homeo Wave, Hyderabad, and Yashodhara Homeo Clinic, Nellore. He has more than 14 years of experience. And today's topic is practical difficulties in implementation of case taking guideline and its impact on cure in homeopathy. Dr. Karunakar, you are welcome to our English session. Please.
Welcome, ma'am. Good evening to all. My voice is audible to ma'am?
Yes, yes, you're clear.
Yes. Okay. So,
if possible, at your WhatsApp.
Okay, sure.
Same, Dr. Karunakar find it very difficult. So,
okay.
Okay, you can begin the session, Dr. Karunakar.
yeah, definitely.
Okay,
So thank you to giving this opportunity to all, and also you are all experienced people. So, but it is not a learning process. So, doctor is a very good learner for till the end of life. So, in this class we have to review our knowledge, because everyone is qualified, everyone is has been practicing very nicely, and every person has good experience with homeopathy. But in spite of that, you have spent your time to learn something and sharing your experiences to others. It is a very good concept. So why we are not succeeded compete with allopathic people, little bit weak behind it. Why? Because we are not sharing our knowledge and we are not sharing our success one and to all. So that's why we are little bit behind to allopathic people. It's my own experience. It's my thought process only. So while sharing the knowledge, so we are enhancing our knowledge. So, and also we have learned so many techniques. So if you think we are observe the stalwarts of homeopathy, their techniques are different. The Kent technique is different and Bonihausen technique is different, like that. So here all people aim is one. Like that, our homeopathic people aim is one. Our aim is to cure the disease, to serve to the sick humanity. So in present scenario, the cure is possible or not? It is the biggest, toughest question to everyone. Why? Because the definition of cure given by our master Hahnemann is quite different what we have thought in present scenario. So just we have to imagine the cure is possible or not. What is mean by cure? So why cures are happen by treating the individual, sick individuals according to the similar principle only? Why not some other process like that? So I would like to discuss this one. And also, everyone said before going to discuss or start my session, one quotation I have to discuss all with you. So that is, success depends not only on their knowledge but also on their ability to grasp. It is very, very optimal statement to us. So every homeopathic man, whoever qualified from the institution, whoever practicing, who have been continue the practicing, everyone, they have good knowledge. But we are not, in my experience, so still remaining, there is a little bit confusion, little bit inferiority compared with all other people. Especially, I worked as a lecturer. What I have observed in my students, most of the 10 years of experience, what I have observed in the students, so no one is coming up with the confidence, I have competed with the other modern people, or I succeeded in my practice like that. Little bit confusion. Why? Because so many reasons for that. I would like to discuss a few reasons what I have observed in my experience. So similarly, practically also, most of the people came with common features. They are asking, the first question is, my disease was curable or not? The modern people are simply escape. There is no possibility of cure. In their point of view, cure is so the only palliation method. Hahnemann clearly stated that. So while discovering this similia principle, the cure is possible only by treating the sick individual according to the similia principle only. Similia principle. It is a very, very, now you have to observe, so many principles were discovered by our Hahnemann, Master Hahnemann. So the modern people will reach now. Recently, they have introduced one particular theory, but it was discussed by our master 270 years back. What is the theory? Quantum theory. So what is meant by quantum theory? Now it is a popularized theory. So much research work was going on in this concept. What is the quantum theory? It is equivalent to individualization theory. It is equivalent to individualization. They are started, each and every individual, they are unique, their disease is unique, which medicine is working for on the individual base. The individualistic concept discovered by our discussed about our master, they will reach now. It is a very, very fortunate thing to us, but no one has accepted our individual concept, all other thing earlier. But now everyone has accepted, and the people and modern people and whoever having little bit of doubt or benefiting, everyone ready to accept it and converted into homeopathy, and they are enjoying with the fruits of homeopathy. They are ready to taste the fruits. So that's why in that even such a great popularity is there in homeopathy. So few people, we are little bit back. Why I used this one is, even Hahnemann himself used that word, but Hahnemann never used in this concept. He was used, if you go to the literature, Hahnemann used many times true homeopathy, true physician, true sick individual, true sickness. So what is meant by true? What is the difference between two? Why Hahnemann was used most of the timings, this true physician, true homeopathy. So means, what is the difference between true homeopathy? Is it there false homeopathy? So if you are question like that, so what is the inner meaning of Hahnemann was used is, so whoever following the strict principle which are discovered in his organon of medicine. So most of the people nowadays, in my personal experience, or what I have observed in the most of the homeopathic physicians, they were practicing homeopathy on the grounds of allopathic principles. So why I used this term is, even Hahnemann himself stated he has doubt. What he had doubt? So even the people who are joined in homeopathic school,
Doctor,
they
your
fails to understand.
presentation is ready now. Okay.
Yeah.
Thank you.
Okay, ma'am. So doubt fails to understand the original principles of homeopathy. Original principles of whoever following the original principles of homeopathy, cardinal principles, they are called as a true homeopaths. So true homeopaths means certain cardinal principles are there. Homeopathy is a unique system of medicine. So which never founded. It is not a single content. It is the compilation of all medical provisions which were existing on the earth. So it is the compilation. It is one umbrella. If you feel it is an umbrella, it protects the sick individual. It is the compilation. If you take any system of medicine which is existing on the earth, either Ayurveda, Unani, modern medicine, all other things. So one at the earlier days of Hahnemann, that is means dogmatism or empiricism or an idealism like that. So he was trying to understand the each and every medical profession and collect the positive findings and put into the umbrella of homeopathy, and what are the negatives he found. So how they are convincing, how we are explaining, or how we are correcting the negative principle, negative or lacunas in their principles, they are all corrected. So he was converting homeopathy is a complete system of medicine. But we are feeling like that, we are enjoying like that. So we have questioned ourselves. So a little bit we are behind it. So that's why I have used this word. So, but original, my topic is today, I would like to discuss practical difficulties. So in implementation of case-taking guidelines and its impact on cures in homeopathy. So before going, here two contents are there. Number one is case-taking. Everyone, So from the first year to till completion of house surgeon, we are meditating, we are training the students on the basis of on case taking guidelines. 83 to 104, everyone is meditating. Is it possible to implement it? Everyone is ready to implement those principles 83 to 104 in day-to-day practice? We question ourselves. So there are two reasons I have observed. Even some people are having time to implement those principles, but they fails to attain that one. Some other people, they are not having any time. So because of heavy practice, because of more number of patients, even I listen, one physician to see hundreds of patients, more than 100 patients today. Is it possible as per Hanumanini guidelines are implemented 83 to 104? Is it possible to see 100 people? It is one first point I would like to discuss. Another important point is even most of the people who are trained the common nomenclature of a disease or nosological diagnostic labels. They came with nosological. Even you are insisting, questioning yourself. You are exhausted sometimes, but the patient never open his mind. So they want to show some other expressions also. Why? Because is it possible to cure the disease? So by collecting the common, whenever patient came with the common nomenclature or nosological, a patient came to you, sir, I was suffering with rheumatoid arthritis, I was hypertension, I was diabetic. What are the manifest? If you are questioning, what are the sufferings you have? So nothing is there, sir. Sometimes, most of the times we have received answer, nothing is there, or they have explaining only one or two common symptoms, either any disease you have to take on. And also another possibility is there is no original picture which was existing in the patient. So why? Because he never came to you straightforward. He was tried some his known according to his own knowledge or some other medication, some other physicians. So that's why Hahnemann clearly explained here in his case-taking guideline, there are two varieties of patients are there. Always two varieties of cases are there. Always two. So what are they? So there are two types of cases. What is there? Direct cases and indirect cases. Direct cases means, so after development of the sickness in his body, they are consulting with you. So these are pure cases. When pure cases came to you, very easy to take up the case and very easy to constitute the totality and very easy to prescribe the remedy. So very clear. But even another type of cases are there, indirect cases. According to 92 aphorism in his Organon of Medicine, a cases came with another physician. Here another physician means most of the people are thought only allopathic physician or Ayurvedic physician like that. But here the Hahnemann concept is, so not only Ayurvedic or modern people, our homeopathic people also. Here one more point is also we have to discuss. So our homeopathic people never give to any prescription to the patient. How we can understood which medicine they have to prescribe? So what is the status of the disease? This is also another difficulty task to the another homeopathic physician. So that's why Hahnemann clearly discussed about these things. So most of the times we never thought this process which are explained in these sections, we are routinely, we are following the case-taking guidelines. And whatever, so that's why homeopathy is a unique system. Here, why? What are the difficulties? Means most of the patients came with common pictures. The common questions we are asking the patients, and they are explaining common symptoms. Even some patients are afraid towards our questions. Whatever some people are, they stop their treatment. They are not come to the homeopathic man. Why? Because the questionnaire we are framing are most of the timing. So that's why Hahnemann clearly given what type of questions we have to asking while case taking. Most of the people leading type of questions are asking. So most of the timing, whatever the answers we are getting from the patients. So it is another important contraindications of homeopathic prescriptions are, so don't ask leading questions and don't show the favoritism or favorite remedies. So even patient started himself one statement, our mind strike up. One of the remedy, bryonia, rustex, or caustic, another thing. Our question is also like that. Most of the people, they follow. So that's why we are not tasting original results of our original fruits of homeopathy. So why? Because we fails to implement what we have read, what we have explaining in the 83 aphorism. What is that? When the essential qualities of the physician which are needed, every clinician, every physician to possess these qualities. What are they? Unprejudiced observer. The first quality is unprejudiced observer. Another one is so to pay the attention towards the patient, towards the. So third point is the you must possess observe the facts, keen observation. These are the three factors. So the first factor I have to take unprejudiced nature. What is mean by unprejudiced nature? Without come to the conclusion, without examining the patient. Here again, under this topic, two or three aphorisms are quoted. Sixth aphorism is first quoted. Here Hahnemann explained three types of observations. Number one is non-observation. Second one is mal-observation. Third one is keen observation. Keen observation is the quality of the homeopathic physician. Those people who are possess this quality, they are always succeeded in their cases. Definitely the homeopathic cures are obtained by those people only. Why? Because so even most of the timings, what we have seen, we are bending our head, we are writing our cases, but patient was showing. So most of the one case I have to explain in my experience. So one patient, a lady patient came to me and is complaining of the pains in the joints. So especially the small joints and other things. She is explaining the pains are stiffness is there, pain is there, swelling is there, they are aggravated. I inquire about modalities, but she lady was well. So while telling the symptoms, she was showing like that. He was always pressing, he was rubbing or some type of movement he was performing till the end of the case processing. I have so many things I have to observe, but ultimate I have to give. So all are common symptoms I get from the patient. So on the basis of that totality, I have prescribed a common remedy, the Rustax, Bryonia, like that. But if you are prescribed, one more example also I have quoted here. The most of the osteoarthritis patients are given Rustax picture. So that's why most of the people are prescribing Rustax, but it fails. Here is also one more experimentation also. Most of the modern people are claimed our homeopathy is a placebo. Our homeopathy is not at all a scientific method. Why? Because they have provided 100 cases of osteoarthritis. Most of the homeopathic people suggested Rustax is a very good remedy for osteoarthritis. So they have given Rustax for 100 people. Out of 100 people, only 20% people are getting positive result. The 80% people fails. So it is equivalent to placebo effect. They are claiming. Yes, definitely. Why? Because we are also ready to accept there is no right to raise our voice. Why? Because the conducting of experiment is wrong. Why? Because they are not given Rustax characteristic totality. Those patients are having, they are provided 100 number of Rustax characteristic totality patient. Definitely Rustax works. But here they are not provided. All patients are Rustax. Even the commonest pathology, that means the degenerative quality, is the first motion aggravation and continued motion amelioration. But whenever patient having degenerative pathology, they are explained. So our mind strike up, the first one is Rustax. If you are prescribing Rustax, we are not getting positive result from the patient. This is another one. So here we fails to maintain unprejudicedness, and I prescribed on the basis of rubbing or motion. Sepia I have to give that patient. So certain remedies are there. We never thought they are working. Always our mind strike up this Rustax, Bryonia, Phytolacca, Rust, Arnica, like that. But Sepia, Calica, so many remedies were there for Aconite to Zincum metallicum. Each remedy is a very good when you have to observe. So even in the common picture, there is a characteristic, uncommon, single characteristic is patient is performing. When you are not having this quality of keen observation, we are unable to get that one. So most of the people, another quality is also I explained here. Most of the people, totality means total number of the symptoms. Without one symptom is there, so now we are unable to prescribe the remedy. This is the concept which was running the minds of homeopathy, or they have collected more number of pictures from one by one. So out of 10 number symptoms are there, we have 10. So Hahnemann never designated like that in the totality. Totality is not a numerical number, so only qualitative. So before going to that one, so here one symptom is constituting the totality, but we are having false belief toward number of symptoms are our, even number of symptoms are there, so we are unable to prescribe the right remedy to cure the disease. As per my knowledge, there are two types of symptoms were existing in that totality. One group of symptoms which are suggestive the remedy, another group of symptoms are there which are confirming the remedy. So differentiate, why not Rustax? Why the Bryonia only prescribed? That is called confirmatory group of symptoms are there. In every case, you have to take that one. So here, that's why the keen observation is most of. But nowadays, because of negligence, because of there is no time availability, the huge number of patients, most of the homeopathic doctors, they are applying for routine, just their maybe mal-observation or comes under the non-observation. If people are for having this quality, keen observation, so that's why their success rate is 100% in that one. So that's why my sincere point is, so even you have to spend 1 minute or 2 minutes, so don't concentrate on commonology or common pathology or common symptoms which are coming from the mouth of patient. So you have to observe which one is uncommonly expressing a common manifestation expressed. So as per the Hahnemannian classification of the disease, so this is also another difficulty. Later we have to discuss. So the first quality we are mistaken, keen observation, unprejudiced observe. Without observing, we are come to the conclusion we are prescribing on the basis of past experience, on the basis of some other. Kenty has quoted, the car is a very good triad of rheumatism. Awesome. Why those stalwarts are suggested these triads? Is it a real working within our day-to-day practice? So we are unable to experimenting the or tasting that what is the behind reason. Without understanding the behind reason or the technique which has prescribing the remedy for totality, very, very difficult. We are not here, art is not by hearted or following. So most of the people are they are giving Rustax, they are succeeding. I have to give Rustax. It may be acceptable fact in Ayurveda or allopathy, all other things, but in homeopathy may not be possible without understanding the base where a Rustax works, on which tissue it is working, or what is the characteristic every time we have to give. So how we can differentiate similar characteristics which are having compared with the phytolaccar, arnica, all other. So lycopodium is their motion amelioration. Sepia is their motion amelioration. So palestella is their motion amelioration. Why not Rustax you have to prescribe to the patient? That is most important point. Most of the times we are missing. So which remedy? So what Hahnemann explained 3 qualities in the 83 aphorism: unprejudiced nature and sound senses. Your eyes, sometimes the sounds are also gives. Our eyes are gives observing the some objective findings. So like that, these are all different qualities. So when you are habituated to develop these qualities,
there is no need of changing the slides. You have to tell me, otherwise I don't know.
Yeah, okay, ma'am. Okay, ma'am, I'll tell you. So this is another thing. So that's why very, very important. In homeopathy, very, very importance is there for case taking. No other system has. So what's the major difference between other systems and homeopathic system in the case taking means other people, this is, what are the objectives of case taking? This is diagnosis. So it is every system is performing that one disease diagnosis. How? On the basis of symptoms. But diagnosis is not at all. Our homeopathic science tells to you, so we are unable to prescribe the remedy on the basis of nosological names. What is the main aim? Everyone knows diagnosis of the person. But here, one more difficulty, how to diagnose the person. Most of the time, patient tells, I don't have. Even present scenario, everyone said, what is that? Mind is the key point. Mind is the key point. Our students also written, everyone. I have observed most of the irritability, anxiety, fear, like that. So what are these are all normal. Every human being having such a characteristics of fear, anxiety, all other things. So how we can demarcate? So either it is abnormal one or thing. So you have to keep in your mind, most of the timing, according to the third aphorism, Hahnemann clearly stated. What is that one? What is curative in disease? Without understanding the what is in curative in disease, we are unable to cure the disease. So that's why Hahnemann clearly stated regarding the disease diagnosis also, every even nature individual, every disease has two components. Number one is disease common symptoms. Another one is disease individualizing characteristic. So for example, I have to give one malaria fever is there. So the malarial fever is there. So what are the disease diagnostic? High temperature, chills, and rigors. These are the common manifestations of disease diagnosis of malaria. But what are the disease individualizing characteristic in that one? So the pattern of following this cold stage, heat stage, and sweating stage. That is the most. We are observing in our mathematical part also, one particular stage is predominant, another particular stage is missing. If you are not understanding this one, very unable to prescribe. For everyone, we have to prescribe China or some other things. Have to see. Alensky notes, our master has mentioned, terpentine is a very good remedy for to prevent the malaria. Most of the timing we have to give malaria optional is on the basis of nosological names which are derived into our mathematics we have. Nowadays, most of the people are habituated to give streptococcinum is there, streptococcinum malaria. But Hahnemann never stated like that. Without having signs and symptoms similarity in the patient, we are unable to prescribe even malaria or other things. This is also, so here the two components are very, very important to understanding disease common symptoms and disease individualizing symptoms. The disease individualizing symptoms are more important to the homeopathic man to prescribe a remedy, even every disease having those individualistic characteristic features. Another one is, as per my knowledge, I have grasped two things. Number one is, so what is the important in homeopathic prescription or in case taking means you have to observe two things. Number one is how the disease is expressed in the individual. That is more important. So if you take the malaria, one man has only chills, another man has rigors, another one has 101 temperature, another man only 100 temperature. That means this is the presentation of the disease in the individual. This is more important. If you have observed this disease presentation in the individual, every presentation of the disease is a individualistic characteristic to that one. Anything, any disease you have to take, even hypertension you have to take. So 150 by 100. So 160 by 80, 160 by 90, like in the paracetamol, certain drugs they have to discuss. This is a remedy for diastolic pressure, high diastolic. This is a remedy for high systolic pressure or like. So some other factors. So that's why you have to observe the disease presentation in the individual is more important. So another important one is how the individual is reacting to the disease. So the fever is there. One man is quite calm. Another man, so one man has having thirst during chill. Another man has thirstless during chill. So another man, some anxiety has developed even 100 temperature, even 103 temperature is there. The patient, the person never shows any type of reaction. This is called a disease, individual expression during disease. So as per my knowledge, two things you have to observe, very easy to grasp the totality in homeopathic point of view. Number one is disease presentation in the individual. Another one is individual expression during that particular disease. These two are important. Use what Hahnemann stated in the 153 aphorism. So characteristic totality, PQRS, peculiar, queer, rare. In every disease, when you have a keen observation, you have to observe two components. Definitely, you are getting the one or two characteristic symptom. They are able, based on that, we are able to prescribe a good similmum. We are getting that one. So that's why. So here, one more thing, you have to clearly discriminate what most of the time is disease and disease per se. This is also most important one. So what is meant by disease per se? So per se means precondition of the disease. What are the most of the time patient came with you? So they are presenting with the disease manifestation. So you have to interrogate. So what happening before commencement of these changes? So what you definitely said, first I have to develop some sort of weakness. It leads to some other. So during that time, I have developed a little bit diminished appetite, all other. These are the disease perceptible signs and symptoms are most important. So the disease per se means the perceptible changes visible to you. So before commencement of that. So as per Hahnemann and concept, the disease is the end result. Every modern medicine, all other people are giving importance to the most of the timing, the disease. Our aim is not the disease. Our aim is to disease Parsi. Disease Parsi is more important. So literally we have studied this disease Parsi is very, definition is very easy. But when you are practically understood what is meant by disease Parsi, so you are able to grasp, you are getting the totality. Otherwise, these are all very difficult. What my title was suggested that one, the practical difficulties. So these are all. So without understanding, you are not in a position to demonstrate what difference or the finer differentiation. Finer. So the normal physiology and to the pathology is finer, more discrimination is there. When you have to understood this discrimination, very easy to get the totality. When you get the totality, very easy to that one. So that's why this is more important. So that's why that success is not based on the knowledge, but the way to receive the facts, the way to. So that's why here Hahnemann was clearly stated that one case taking definitely. What is meant by case? Most of the timing, the suffering of the patient, but not the suffering of the patient. So the case taking means, so the three qualities are there case taking. Number one is it is a scientific. Everything is evidence. Science means evidence. Show the evidence. So any change happening in the body, you must express it in the form of symptom. The symptom is the evidence of the disease. Like that, the scientific. So the case is a scientific. Case taking is a scientific, artistic, a logical combination, logical process. Everyone has science, but some people don't have artistic. They are what they have learned in the mathematics, they are seen. But we are unable to success with the only scientific knowledge or what we have. So that's why some people are very nicely explaining, but in coming to the practical aspect, they are unable to cope up in the selection of a similar process. So that's why we are not providing the curative process up to the mark in our day-to-day practice. Similarly, what is meant by art? So the skillful application of this, whatever you have now. So everyone has, so here one more point I have to give. Hahnemann was treated most of the diseases with 99 drugs only. But now in Mathemedica, how many drugs are there? More than 5,500 drugs. Is it possible to remember? Is it possible to remember as a human being? And also most of the diseases have equinite or similar manifestations without, or nowadays everyone is habituated the combinations or some other things, whatever rare remedies. What is the statement given by Hahnemann? If you are chosen a rare remedy, you are getting a result also rarely. The cures are also rarely possible. So most of the people who have to choose an easy techniques. Hahnemann clearly stated that one, there is no easy techniques for that one. Hahnemann clearly stated that one certain qualities, especially contraindication, there is no selfishness, there is no patience. We are hardworking, patience, and keen observation. These are the qualities of the homeopathic student or homeopathic physician. This is also another important point. So what we have, so we are missing some other things. So logical, even most of the time, why you have to give that remedy? So a few people are given very nice explanation. So this is the so most of the times I ask my students, why you have to given this remedy? They are beautifully explaining the drug picture, but they fails to correlate. So that's why I asked. So what are the characteristic symptoms of Rustax you have to observe in the patient individual or in the patient? You know very well the Rustax picture, but I don't want. So what are the characteristic symptoms you have to observe in the, most of the timings we are giving Rustax or Bryonia or on the basis of reptorial totality, we have to choose in one medicine, another thing. On which base we have to work this remedy. So the allopathic man very nicely explained. Yes, I have to give a paracetamol. Even Ayurvedic man, they have to explain this is the thing. But coming to the homeopathic man, everyone is asked how your drug is working. Here everyone said choose two answers. Number one is on the basis of individuality. Another one is dynamic plane. But no one is ready to accept it. Either it may be a dynamic plane or either it may be individualization. So without, I asked one question. So without individualization, which creature was existing? Which one was existing? What is the difference between individualization concept bring into the homeopathic system by our master Hahnemann? What is individualization which was existing in the nature? So is it nature is there in the nature without individualization? Which was? So this is also another important concept to understand. So when you understand this concept, very easy to differentiate each and every individual. They were suffering hypertension or diabetes. The common manifestations, whatever we were covering in the hypertension, headache, all. Every patient has come with headache or some other pains, all other things. In the diabetes, there is a profuse urinary. So polydipsia, polyuria, poly other thing. But how we can understand the arriving of a drug prescription to the remedy? That is, the remedy is most important as per Hahnemannian concept. So that's why you have to observe. This is another important. So logic was missing here. Logical combination of either the scientific, artistic, logical combination. So maybe I think in my point of view, little bit logic was missing in taking the case. So correlate the facts. Because logic means correlate the facts. What type of totality we are getting, what type of prescription. If you have taken many types of prescriptive methods were there. So you have to ask most of the people according to which prescription you have to give. Majority time we are unable to. Maybe acute prescription is there, chronic prescription is there, and acute and exacerbation in that different. So one more point I have to give in my point. So Hahnemann was, without miasm, there is no chance of existing any disease in our body. But Hahnemann clearly stated in his chronic disease, in his that you have to give azoic remedies. This is the first point. Another one is, if you read Metromedica, so every under that sphere of action, it belongs to a psychotic or psoric or some other miasmatic thing. But what is the difference? Wow. You have prescribed that remedy, it works on the basis of miasm or any other methodology is there. So if it works on that one, every remedy is considered as a miasmatic remedy. What is the need to explain Hahnemann was described miasmatic prescription? What is the need to give a miasmatic prescription? What is the need to give a canon? Most of it, according to fifth aphorism, constitution. These are the two words commonly used by many homeopathic people: constitutional diagnosis or miasmatic diagnosis. So maybe is it possible? It is very easy to identify each and every individual. So literally, it is a very easy to read physical makeup and mental makeup of the patient, all other things. So here, one more important point. So when you go to that one, either constitutions are changeable or not. Most of the timings, most of the patients are came with me, sir, my husband was very clear. My child was the behavioral pattern is very hard. Is it any medicine is there for treating that one? Yes, I said, yes, medicine is there. Is it completely curable or not? This is another important question. How much behavior, how much change we can expect it from that one? So immediately that one, so there is a big queue line is there. All drunkards, all irritable persons, or all abnormal mental behavior, that one. So this is very difficult to answer in that one. Either constitution is changeable or not. If constitution is changeable, and regarding curative process also have what Hahnemann stated, the definition of cure, complete restoration. The word used in the first aphorism, the sole aim of the physician is to restoration. What is meant by restoration? So without recurrence. So nowadays, the most of the timing, so allergies, hypertension, they have raised one question. If you ask for your principle, cure is possible. It means I don't want to use any medication. How much time has taken to cure this one? So diabetes, they clearly stated one. So for lifelong treatment is there for allergy, diabetes, all either cardiac or neurological, all other things. As a homeopathic man, what you have stated, how much time has taken, what is meant by cure? There is no recurrence of that hypertensive episodes. There is no recurrence of reduced sugar levels after prescribing, either whatever, either miasmatic or constitutional, all other things. If you are asking this question, most of the timings, so a few people are answer very nice. Those are logically explaining certain things. But this is the biggest question. I have dropped, even we have dropped that allopathic man, what Hahnemann speaks, so to stop certain people are, so here what I have observed, so two extremes of people are there in homeopathic prescriptions also, in the case taking, whatever. So too much believing, there is no believing. These two types of group of people we have to observe, everyone. One experience, one statement I have to give. So there is a the female is the enemy to the another female is there, or like that statement is there. A homeopathic man is an enemy to the another homeopathic man. Why? Because why I have to use this statement means, so one man stated the obesity is curable, cancer is curable, like that. So another same professional man stated that there is no possibility of cures like that. Most of the times, what I have received, so I have given either scope is there in surgical emergency cases. What is meant by emergency cases? What is meant by here? The definition itself there. There is no scope of homeopathy in surgical acute emergency situations. What I have received that condition. I raised my voice in that aspect. How many acute emergency conditions were mentioned in the repertory? There is a strangulated hernia is there. Kent has mentioned certain remedies. Even shock is there. He had mentioned certain remedies. Even surgical shock is there. So many varieties of shock conditions are. There means I asked one question. Either they have simply in the manner of routine process they have recorded, or they have treated the cases, they have treated some experiences they have quoted. So every homeopathic man suggested that one, our homeopathic Maitre Medica is a Bible. Our Maitre Medica is purely experimental product, a repertory. So it was just indexed to the Maitre Medica. If you feel it is an index to Maitre Medica, Maitre Medica was the pure product of an experimentation. Either we are able to provide a positive result in those cases or not. Strangulated hernia, shock, even angina pectoris. So how many people are there enough to treat the cardiac cases? A few people are there. I'm not questioning about all other things. So why I am making a few people are succeeded. It is not the success of system of medicine. When most of the people are success in the system of medicine, and they have to create a awareness in the public is coming towards homeopathic system. Even nowadays, what I have observed, public is ready for taking up even. Why? Because there is no alternative for them, or some sort of fear. Even they want the symptom painless treatment. They want some painless treatment. So is it how many cases were died with the, so it is also a biggest unfortunate thing. Even patient was died in any other hands of medical profession, it's not a questionable. But one man is died in the hands of homeopathy, it is a biggest questionable. Either we are not unable to treat that one. So sometimes the patient is ready to give a chance to us to observe. One case I have to explain. One patient is admitted in ICU unit. So the patient has developed uremic. That means creatinine levels are high and uremic conditions are there. They are raised their hands. So their straightforwardly decided to death within 3 hours or 4 hours. So they are the good believers to homeopathy, but even the allopathic man stated, don't use homeopathy in these conditions. Most of the timings, what you have to think, they problem. So the patient said, only uremic condition is there, he is unable to take the breath. This is the only statement passed by the patient. How I can treat? How I can? So I asked, how is thirst, how is our appetite, how is your head, or either coldness is there or like that? Is it possible? Most of the timings, objective symptoms we are missing. So we have to observe while telling the story of the patient, even according to the Hahnemann in the case taking. So if you want to consider the totality, there are 3 sources are there. So that means the symptomatically 2 things, subjective symptoms and objective symptoms. So nearly 151 varieties of symptoms are there, but under broad classification, subjective and objective. What are the 3 sources? There are 2. Number one is 3 sources. Number one is patient himself as a subjective symptom. Another one is friends or whoever attended along with or who are closely observing that one. Most of the timings here correlate, we are unable to grasp the originality. So for example, a mother and child came or a wife and husband came to your clinic. So if you have observed, their statements are very, very beautiful. Even there are quarrels. So husband described, my wife is very good, is unable to like that. But always she was observing that. Anything suffering or husband is the cause for her illness, how she was explaining. So some patients are come up. So without, we are not having this case-taking guidelines, what Hahnemann has given, we are unable to get the confirming the symptomatology. As per 98 aphorism, Hahnemann clearly stated, after completion of your processing, that means patient explanation or attend or other things, so you have to confirm either it is right or wrong. So why? Because here is also two types of patients who are existing. I already explained two types of cases, direct and indirect cases. Direct cases, no problem. Indirect, most of the cases are indirect cases. Another one is two types of patients. That one is hypochondriacal and indolent. Some patients are explaining very nice. Sir, I am showing like that. We are how much pain is there? We are prescribing chamomile to the patient. They are unable to touch that one, we are going to prescribe arnica, some other aconite, all other things. So sometimes it may be suitable or matching, sometimes they are unable. So without confirmation, we are here. Why I am telling, I bring into your point is the confirmation is more important. Most of the timings we are unable to confirm whatever the remedy comes. Kahneman clearly stated that one in the case. We are unfortunately throwing the similar remedies to the patient. But we are not in that position. We are always dare enough to state that one, I am prescribing similar remedy to the case. Either whatever the things, different prescriptive methods are there. So which prescriptive method is workful, how your drug is working, these are all practical difficulties in the case taking. When you are able to explain each and every step, when you are convincing your patient, when you are that one. So I prescribed that ventilator patient also have seen. So even sometimes that repertory, you have to, the euthanasia is there. You have to see, observe, euthanasia, mercy killing, the drugs were there. Is it, so in every case, certain patients they are always insisting to give me some remedies, doctor. I want to die. I want to die. I am unable to suffering this one. Have you given this Laxis or some other drugs? They are killing the patient. Is it possible? So in which circumstances they have to explain, use those terms. Try to understand each and every rubric, each and every mathematical. These are practical without understanding the story. And one more difficulty also, the converse.
Hi.
Sir.
Dr. Karna, we need some discussion on the subject so that since the subject is a wider one, we can have a second part if you want.
Yeah, definitely, sir. Definitely, sir.
A lot of people want discussion. That is one of the beauty of the presentation. Over to Dr. Rajini.
Yeah, definitely, sir.
Thank you, Dr. Danish. Actually, Dr. Nod mentioned to share the PPT, so I closed it. I think he speaked to the floor. The participants, if you have any questions, please raise your hands and ask question. Dr. Danish first. Okay.
Yes, Dr. Karunakar, it's really a very good session indeed. You are just running like Vande Bharat Express.
Yeah.
There is no way to stop it because all the things you describe are practically a very good thing. But as we all know that the homeopathic protocol of research need to be changed accordingly, rather than we are still sticking at the same methodology adopted by the so-called scientific people or the other community. That's the reason why the same thing happened. Why Rostox fails in 80 cases of rheumatoid arthritis? Because there is no such thing called a specific medicine in homeopathy. That's the reason. But the individuality is entirely different. For example, if you get some similar symptoms in 80%, 80% of a person in Rostox, but there are 8 individuals who are different. So we need to find what is the difference between each and every medicine and is the remedy. Practically, it is that kind of research need to be done. Instead of giving, say, one remedy to a particular patient, then what we are proving is that homeopathy is wrong. If homeopathy is right, we should do in a different kind of prescription. That is, each medicine have its own ability to produce its own symptoms. So all the 100% may require 100 medicines. Then only homeopathy is right, and not the right way. That's what your lecture is all about. And congratulations for that kind of thoughts you shared in this forum. And of course, we need a wider discussions on different subjects also. You can What's your opinion on that? And congratulations, because only the very eminent personalities like Dr. Hariharan, Dr. Jose Sara, and all are there to participate in discussion. So,
Yeah, definitely, sir. Why I am taking this one? You are good experts. When you are giving such type, you are an ideal to someone. When you follow that one, definitely you are brighten one lamp. Automatically, that why homeopathy stands means those people who have strong confidence toward the system of medicine. Because of that only, Hahnemann clearly stated that one twofold existence of homeopathy. That means certain people are having developed their thought process, are keeping that one without sharing how they are following. So that's why this group is very, very, that means very cooperative, means sharing knowledge is that one. So that's why we are all bright in that one, enhancing. Definitely, we are enhancing our system. Once the system is enhancing, automatically some people are coming to boost up into that one. Even one man is greatest in that system, we are unable to cope up with one. It means my hope is everyone is ready to answer and everyone is give some sort of positive vibes to the upcoming generations. Automatically, we are converted into entire world. So what Hahnemann was slogan, homeopathy never fails, homeopathy fails. We are strongly that one. We are trained and explained, yes, there are clear guidelines are there in each and every aspect. Homeopathy is a clear scientific aspect. So when you are develop this concept in the public and as well as in the whoever interested or upcoming generations. So till everyone, so the future is homeopathy. Future is homeopathy, definitely. So that's why now, as per WHO nomenclature is also sound. When we are not using our voice, the medical mafia, which is giving false statements on and occasionally. So because of everyone is attracted very fast to quickly to the false statements. So that way, so my intention is like that, clearly bring it to your points, sir, that if anything mistakenly or wrongly stated that, please excuse me, because of I corrected it and next class is also.
It's okay, doctor. Now, Dr. Hariharan, you can.
Sir, okay. Doctor, your lecture regarding the case taking, that really I am appreciating, and it is a very deep knowledge also. It is very deep knowledge. Okay, see, can I ask a question to you? Is the constitution and the miasmatic is the same or different?
The constitution is the part of miasm. Constitution is the part of miasm. Constitution is one component in the miasm, sir. The miasm is 5 qualities. Number 1 is mind and disposition, temperament and constitution, and modalities, and desires and aversions. These are the 5 qualities, the components to constitute the miasmatic diagnosis.
Then what is the constitution meant by?
Sir?
Then what is the difference between miasm and the constitution? If I say a patient, I am treating a patient according to the constitution, according to the constitution of that patient, is that will cover the miasmatic attitude also or no?
Yes, sir. Definitely miasm. Without miasm, there was no disease. But here, what happening? Certain in the miasmatic aspect, certain possibility either structurally or certain tendencies, certain develop. They are, so that means they have developed certain types of constitutions. That means, for example, barrel shaped chest is there, or stoop shoulder constitution is there, and they have developed by there during that particularity. So frequently they have developed that one. So there is a need to change that constitution. Then you have to, when the miasmatic prescription fails, you have to stick on to the only constitution. You have to give a constitutional remedy to change the constitution. In the constitution also there are, by birth itself, there is constitution we have habituated or obtained, it never changeable. Only developmental, because of your change. Before joining your college in that one, you have some type of attitude. After joining that one, the situations, the circumstances to make it very strong. So most of the times we have done. Earlier he was not like that. Now why he have behaved like that? That is the constitution. It is the part and parcel of miasm.
Okay, thank you, sir. Thank you, sir. Another question. See, Dr. Jose Isaac is waiting. Yeah. Even then, Dr. Jose Isaac.
Hello.
Doctor,
yes.
Hello. Okay, you can ask. You can ask Dr. John Isaac, sir.
Okay, but regarding, see, as you said, constitution cannot be changed, but can be modified.
Yes, sir. Definitely, sir.
That is the
Constitutions are
point.
modified, plus
Yeah.
developmental constitutions are changeable, sir.
Yeah, you can put on.
Congenital constitutions are not changeable. Developmental, during the development, what you have obtained, they are changeable, sir.
Yeah. So you can put on 15 kilos or 20 kilos if you exercise and take some good food and all. But after, when you stop that, you will go back to your constitution. So constitution
definitely,
can
sir.
be modified to 10%
Yes,
or
definitely.
15%.
Modified,
That's all.
and through which we are adopting the disease,
Yeah.
sir. Adapting. Adaptation is more important than curative process also.
One
When
more.
there is
One
no
more.
possibility of cure, adaptation takes place. The adaptation saves the human being, sir.
Yeah. So the main thing is constitution, and the constitution is formed when the zygote is formed. And along with that, the myosomes of the parents will be transmitted to the constitution. So constitution first, and myosome is the disease factor which gets embedded in the constitution. So we are, with our treatment, what Hanuman also says is give acute remedies or something, then go to the myosome, then finally to the constitution, constitutional correction. So myosomes are embedded in the constitution, or the disease factor that affects the constitution is the myosome.
Yeah, definitely.
Yeah. So that is, I think it is more clearer now.
Yeah, definitely, sir.
Yeah.
Thank you.
Okay.
Thank you, doctor. And thank you all for participating for today's session. And now it is the time for the Malayalam session. Thank you all the participants in English. Thank you, doctor, for sharing your knowledge. Thank you so much. Everyone, bye-bye. Dr. Ram Parvesha, sir, I think he want to congratulate you. Just 1 minute, 1 second.
Thank you, Dr. Anjali, and Namaskar, everyone. And congratulations, Dr. Karunakar, V.K. Karunakar. Very good presentation. Your case-taking presentation was perfect, blend, experience and clarity. The main cause of disease, according to law of homeopathic science, SORA, psychotic and syphilitic, there are two types of symptoms: subjective symptom, objective symptom. Subjective symptom is a very important symptom according to a sick patient, and objective symptom observes the doctor. Thank you very much.
Thank you so
very
much.
thanks behind our IFPH whole team. Thank you.
Thank you, sir. Thank you, sir.
Thank you so much. And Dr. Karunakaran, please come again and complete the complete your topic.
Definitely, madam. Next class, I will show the videos also, madam. That one I want to present.
Yeah. Even I was ready to share, but you didn't mention me. That's why I closed. Anyway, thank you, sir, so much.
Thank you.
And now I am inviting.
Sir, thank you very much, Dhanesh sir. You are very supporting me, sir. Thank you very much, sir.
Sir, one suggestion. Sir, one suggestion is there. We want more discussion. We want more discussions.
Yeah.
That is very important.
Definitely, sir.
Okay, and there was two little princess sitting in the lap of Dr. Ram Parvesha and Dr. Dhanesh. Thank you for those two princes. Anyway, I am welcoming Dr. Shaila for moderating Malayalam session. Doctor, you are welcome, please.